Hello, welcome, and thank you for joining us at our event today to talk about practice placements in the community managed mental health sector. This project is an exciting and innovative project that was funded by Health Workforce Australia via the New South Wales Health Education and Training Institute, and in particular the Sydney Interdisciplinary Clinical Training Network. It's a project that involves a consortium and our project partners, along with the Mental Health Coordinating Council, are the University of Sydney, the University of Western Sydney and the University of Notre Dame. My name's Tina Smith and I'm Senior Policy Officer at the Mental Health Coordinating Council, and I was the project manager to this activity we're discussing today. The Mental Health Coordinating Council is the peak body for community managed, community sector mental health services and programs in New South Wales. The community managed practice placement project was a complex piece of work undertaken in a short period of time, and essentially there were 4 publications that resulted from it. There was a scoping paper that informed all of the other deliverables of our project. From that was a placement guide developed that I will be telling you more about later. There was also a placement listing developed, and we're thrilled that despite having just 4 host organisations participating in this pilot, our placement listing actually now contains more than 20 organisations across New South Wales who are keen to accept student placements, to have practice placements moving into the future. Those students are from a variety of disciplines. The 5 key disciplines in mental health that many of you will know, medicine, nursing, psychology, occupational therapy and social work. But we also explored the disciplines of exercise physiology and dietetics nutrition as a way of exploring what's possible around the physical health agenda that's so important for people with mental illness. The 4th document is a final report on the project, which also captures the research and evaluation activity that sat around the project. So that's a brief overview of the fundamentals of what we did, other than to note that around all of that was an experiential practice placement pilot where 22 students from a variety of disciplines actually went out into the community sector to help inform and shape some of our thinking about models and costings and practice skill sets and supporting documents and the publications that I've just brought to your attention. The scoping report was absolutely fundamental and foundational to this work. The literature review that informed it was undertaken by Cathy Hughes with Engage to Change Consultancy, and it really helped us right from the beginning to understand what it is that we were setting out to do and where a lot of the opportunities and barriers to exploring building practice placement capacity within the community sector sat. And that in turn was informed by a community sector survey of our entire MHCC membership across New South Wales. So I do recommend the scoping report to you. So that's a little bit about our project. I guess what I haven't touched on is why this is important. This project for MHCC was ultimately about creating or contributing to creating tomorrow's workforce in mental health today. I would like to introduce to you our first panellist who is Dr. Cathy Kesselman. Cathy is a consumer representative. For those of you unfamiliar with that language, that means that she is a person with lived experience of both mental health and recovery, mental illness and recovery. And Cathy's also the president of ASCA, which is Adults Surviving Child Abuse, and a former GP. Welcome, Cathy.
Thanks, Tina, for that, and I'm very excited to be here and very excited about this era in mental health that we're entering. We're moving away from an illness model to one which is trauma-informed, recovery-oriented and focused on health and well-being. And pivotal to that is the role of consumers and carers, not just as a voice, but people who have a say in the outcomes of issues that affect them, and obviously that's around their lived experience. So this practice placement project is very exciting because what it does is allow students to be placed within services within the community managed sector which are recovery oriented, and so which engage with consumers and with carers to allow students to understand that a person's lived experience is the way to work with and from, that people's own aspirations need to be understood, that they need to be supported towards recovery to their own definition of recovery, not one imposed by clinical services. So that's a very unique experience and very exciting to see the potential for this to grow. I'd really like to commend the scoping report put together by Cathy Hughes. It's a wonderful, comprehensive guide for the future, for a sustainable, informed model that allows collaborations, future collaborations, information and structures, so that more students will have the opportunity to engage with this process and really understand that true collaboration with consumers and carers is absolutely critical to the mental health of our community.
Our next speaker is Karen Burns. Welcome, Karen.
Thank you.
Karen is the MHCC board chair. She is also the CEO of one of our 4 participating host organisations, Uniting Care Mental Health. Thank you.
Thank you, Tina, for the opportunity to speak about the practice placement program. Uniting Care Mental Health has been providing opportunities for students to engage in practice placements for many, many years, and we feel it's a fundamental role that we provide as a community managed organisation to contribute to the professional development of students who will also be our workforce of the future, we hope, through opportunities such as this. I'd like to speak about one example with one university where we over the last number of years have had the opportunity to provide placements to medical students in partnership with the university, and it's been a wonderful experience for both ourselves as Uniting Care Mental Health and the students. The students have been able to engage with programs across the community that keep consumers well and support their recovery journey. And they've also had the opportunity to work with a diverse range of staff, from support workers, peer workers, psychologists and other GPs themselves. And that's allowed them to have the opportunity to understand how a community managed organisation functions, the role they play within the mental health sector, and also speak to these staff to understand their experiences of working within a community managed organisation. It is also really important to speak about our staff of the future, to have the opportunity to expose students to the role of the community managed sector, to be able to contribute to their experiences as a student and support them on that journey to their qualifications is something that not only do the students benefit from, the organisation benefits from as well.
Hope, yeah,
Yes.
Beautiful. You can't teach hope, can you?
No.
You have to experience it, I guess. Okay, our next guest speaker is Professor Lindy McAllister. Lindy is Associate Dean of Work Integrated Learning at the University of Sydney Faculty of Health Sciences. And Lindy has been an enormous mentor to us throughout this project. Welcome, Lindy.
Thank you, Tina. It's been a real pleasure for my faculty to be involved in this project. for a number of reasons. One is that it is the community managed sector, and it is a sector that's growing. There's a growing demand for services, and it is working in different models of care to what our students have typically been able to be exposed to, which is more the acute illness end. So the recovery models and the consumer participation and the collaborative care models are really important for us to expose our students to. So this is a wonderful opportunity for us to be involved. It also gives us the opportunity to involve more students perhaps than have typically been involved in these services. And I see great potential for example, exercise physiology students to be involved, and other allied health professionals beyond those that have traditionally been part of the mental health team. The really exciting part about this project is that people are coming from with a very fresh set of eyes, and so the potential that exists for really high quality learning programs isn't being constrained by very fossilised traditional ways of thinking about how student placement should work. And it's been conceived right from the start as an interprofessional learning opportunity for students, and really that's where workforce training needs to go. Students have to be able to work in teams, they have to be able to work collaboratively with consumers and carers and all the other staff that are involved. And so this is just a fantastic project for our students to be involved with in the future. I think the learning outcomes will be unique and far greater than we're currently getting from many of our other placement sites.
The placement listing, Lindy, contains a lot of information about who those organisations are and the many hundred programs that they offer in the mental health space around accommodation and leisure and employment and family and carer support. We ended up with 20 organisations listed. What do you make of the fact that we now have this listing with 20 places where students might go to learn?
Look, I think it's fantastic, actually, a little bit surprising, because I think momentum was building across the life of the project, but to have 20 organisations who've actively said we want to be involved in student education is terrific for us. We're constantly looking to provide new kinds of learning opportunities for students, and so the placement listing, because it's so detailed around what programs are being run in the different organisations and their models of operation and their requirements for student involvement, it actually makes our job a lot easier in terms of what kind of students are going to be best placed with any organisation and with any program within an organisation. And in fact, it's fantastic that that material's already collated there for us to work with allocations, because often this is the sort of thing that we spend a lot of time pulling together for ourselves as a university placement provider.
Our next guest speaker, who is channeling in to this event from a remote location, is Professor John Buchanan. John is the Director of the Workplace Research Centre at the University of Sydney School of Business, and the Research Centre were contracted to undertake the evaluation and the development of the project final report in partnership with MHCC and our consortium. John, welcome.
Okay, well, our centre was asked to evaluate the impact of the practice placement projects in the community health sector. The fieldwork was done by Linda Scott, and it was a pretty positive set of outcomes we uncovered. Look, the most important one was we identified that the program did result in an increase in the number of placements, particularly for students, the group it was aimed at. And it did also, in a number of instances, improve the quality of those placements. It was especially important for giving better structured orientations. It resulted in more clearly outlined projects for these people to do. And it provided a good set of learning outcomes where they could be found. The evaluation did also find, however, that there was a displacement effect. Whilst this increased the places for higher ed students, it did affect placements for others, sometimes those in the vet sector. And the main barrier to the further diffusion of this type of arrangement was the poor collaboration between the education institutions and the workplaces. You need to have time to build up these collaborations. The pilot was conducted in a relatively short time period, and this limited the reach of the program. I suppose the most important finding, however, is that for programs like this to succeed, it's important to have an intermediary, an organisation that can bring together employers and education institutions, and that third party can actually get a better outcome for the key players involved because they have the time to focus on making this type of activity work well. The main findings in terms of how can we make practice placements in the community mental health sector grow is that there needs to be greater recognition in the sector that work sites do provide a place of learning. This is a relatively weak tradition in the sector, and if there is a tradition to be developed, it's got to be around that notion that a workplace is a site of learning, not just a site of service delivery. But there is also a need to get supportive structures in place. It's all very well having recognition for what is required, but you also do need to have people who are properly trained in structuring the placements and people who can help support supervisors take on that additional role.